Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes, executing a speaking role play after a long time. But yes, because we have got new students, so I would like to post few things for you. In OET exam, speaking exam, you will get two role plays, not one. As we practice one role play a day, so it doesn't mean that exam also will have one role play. Exam में दो role plays आएंगे. Again, you will get 3 minutes to prepare. You can write anything on the question paper in first 3 minutes. Then you have to speak for 5 minutes. Then you will get second role play. And again, you will get 3 minutes to prepare and then 5 minutes to speak. Also, I would like to tell you few things about speaking, that there are no marks for the facial gestures. It's only the recording which has got the marks, the audio recording. What it means that I can do the speaking role play looking at my role play card, means I don't have to look to the examiner. And the most important instruction is that examiner is not an examiner. He is just a patient. Just a patient. He does not have any marks. Even if you ask at the end of the role play, do you think I performed well? Do you think I did not perform well? It does not matter. So please do not get into fake satisfaction. The audio recording is that which will give you marks. So that means facial expression has no marks. So please follow this protocol. And in first 3 minutes, it is very important to utilize time by writing it on the question paper. These are the instructions. Talking in Hindi, 3 minutes का रोल प्ले है, 5 minutes आपको बोलना है, 3 minutes में आप कुछ भी लिख सकते हो क्वेश्चन पेपर में, रिकॉर्डिंग ही जाएगी, फेशियल एक्सप्रेशन का कोई मार्क्स नहीं है. Making it simple. Coming back to the topic that we would like to cover today as this one. So that's the topic of the day. I'm just going to pick it up. So you are the nurse who works at gastroenterology clinic. You see patients after they undergo test at the clinic. So you should realize, always write first line. So good morning. My name is BKM. I am a nurse. So always write, always write. I am a nurse here. And patient comes to you. और पेशेंट आपके पास आता है. कब आता है पेशेंट आपके पास? जब वो you see the patients जब वो टेस्ट करवा लेता है. You are talking to Jenny Vesely, a 25-year-old who has been diagnosed with irritable bowel syndrome. So that is why tenses are so very important. I always say tenses are the most important thing. I always keep on telling you tenses. That is why tenses are so important, because now in this role play, you will see has been diagnosed. So that means it is a present perfect tense. That means ho chuka hai. It's done. Patient has already been diagnosed with IBS. The patient is not sure about the conditions and needs advice about treatment and management. That is what is the role play. So obviously the first line, if I have to say, so I will write this line again for you. Good morning. My name is Bhupesh or BKM. I am a nurse here. And I can see from your test results, use same thing. It will make it easy. And always write first line. I can see from your test results that you have been diagnosed with, most important, you have been diagnosed with irritable bowel syndrome. So that is how you start the role play. Then you ask a simple question. You have been diagnosed with this. So then you say, am I right? So this is the second thing that you will ask. Am I right? So then patient, और अगर patient को नहीं पता इस वाले केस में, in this case we are not sure whether patient knows about it, तो ऐसे रहने देते हैं. Find about the symptoms she experiences. So ask about the symptoms. So first, what would we ask? Always write. So this is what you are supposed to write in 3 minutes. Could you please tell me about your symptoms? This is what you are supposed to write, because it's always difficult to ask questions. So could you please tell me about your symptoms? Okay, what kind of symptoms do you have? What is the duration? What is the frequency? Do you have pain? So these are the small things you write. So what is the duration? Do you have pain as well? As a fluency, do you have pain as well? Okay, and what's the frequency? Frequency means how many times are you having this? How many times do you feel this? Yeah, these symptoms happen to you. So these are the questions that you are supposed to write. Find about the triggers she may have noticed. So you will say, have you noticed? Again, यहाँ पे दिया है have noticed. So have you noticed? Always use present perfect is the best tense to ask simple questions. Have you noticed any triggering factors? Then patient will say stress. अगर वो अपने आप नहीं कहता, if the patient does not speak by himself, you say, do you have stress? So these are the things you write. Then you will tell simple IBS in simple language. It is irritable bowel syndrome. There is no clear cause, but intestines probably become sensitive at times. Smooth muscles become overactive, spasm, and it can lead to cramps. IBS majorly has either constipation or diarrhea or sometimes both. Like in your case, you are having both the things. I would like to outline the treatment options that you have been. So only thing you have to do, patient has been की जगह you have been. आप patient से बात कर रहे हो तो आप कहोगे you have been. So this is the only word you will change. So you should not write about those things. जैसे अब ये सिंपल है, these are the simple instructions. इसको मत लिखो, क्वेश्चंस को हमेशा लिखो. ये फर्स्ट लाइन को हमेशा लिखना है. ऑलवेज राइट फर्स्ट लाइन, ऑलवेज. क्वेश्चंस को हमेशा लिखना है. फिर then you will say you have been supplied with this pain diarrhea, you need to make diet changes, avoid high. Now it is simple. ये सब आपको लिखने की जरूरत नहीं है. अब आपका पेपर 3 मिनट्स ओवर हो गए हैं. अब आपको 5 मिनट्स के लिए बोलना है, तो अब आप बोलोगे, good morning, my name is Bhupesh. I'm a nurse over here, and I can see from your test notes that you have been diagnosed with irritable bowel syndrome. But before we can proceed further, can I ask you some questions? Well, yes, nurse, you may. Okay. So first of all, I would like to know about your symptoms. Could you please tell me what kind of symptoms do you have? Well, nurse, I'm having constipation. Sometimes I'm having diarrhea. Okay. Could you please tell me the duration? Well, it's just really hard to say because it is almost constant when it happens. You know, there are some tough days when I'm having constant diarrhea. There are some days when I'm having constant constipation. So it's really bad. Okay, I'm sorry to hear that, but don't worry, we are here to help you. ऐसे एक लाइन बीच में बोलो. अब ये नहीं है कि अपने फ्लो में चलते रहो, उससे उसको कनेक्ट करो. पेशेंट को कनेक्ट करना ही सबसे ज्यादा मार्क्स देता है आपको. आई एम सॉरी टू हियर दैट. But could you please tell me about frequency, that how many times do you experience these kind of symptoms? Well, it happens like 3 or 4 times in a day. When I'm having diarrhea, it's just like really bad. And when I'm having constipation, then I do not kind of have bowel motion even for 2 days, 3 days in a row. Okay. So do you have pain as well? Well, yes, nurse, I do have pain, and it is really kind of a different pain, but it's really severe. Okay, don't worry. We are here to help you, and I would like to ask you that have you noticed any kind of triggering factors, like stress at the job or something like that? Well, nurse, I'm working as a manager in a food company, and it's really stressful. Okay, and stress, yes, I have noticed that stress, when I am stressed, that then my uh this pain is worse. Okay, so now I would like to tell you, as I can see from your test results, that you have been diagnosed with irritable bowel syndrome. Let me tell you about this condition. Irritable bowel syndrome has no clear cause, but in this particular condition, intestines probably become oversensitive at times. Smooth muscles become overreactive and can lead to spasms and cramps. And IBS is majorly having two kinds of symptoms, constipation or diarrhea, or sometimes both. As I have collected your history just now, so in your case, you are majorly suffering from both the symptoms, and that is why it is obvious that you are having IBS. So don't worry, this is a kind of a condition which can be treated, but you need to be very cautious and you need to follow the instructions. So would you be able to follow the instructions? Yes, of course, nurse. Okay, then I would like to tell you about the treatment options. You have been supplied with the medication for the pain. So as doctor has already prescribed you the medications, so please take the medications on time. Also, there are medications for diarrhea and constipation. So when you have diarrhea, take the medications for diarrhea. If you have constipation, take the medication for constipation. Am I clear? Yes, nurse. Okay. Also, you need to make some life change, some diet changes. Like you have to avoid high fibrous foods and gas producing foods like cabbage, and you have to eat regular meals. That means after every 1 or 2 hours, you should have smaller meals. Don't eat a big meal after like 3, 4 hours. It's better to have small meals after 2 hours, after every 2 hours. Are you getting my point? So you have to decrease the amount of food that you take in one shot, but you have to increase the frequency of meals, that you have to eat the meals regularly. Am I clear? Okay. Also, I as you have told me about your stress, and stress is the major reasons when it comes to diseases like IBS. So in this case, management of stress will play a very vital role. So I would like to suggest you activities like yoga, meditation, or gentle walks, which can be really fruitful in alleviating or in decreasing the symptoms of IBS. Am I clear so far? Okay. Then I would like to reassure you there is nothing to worry. It's just kind of a condition that is normally found. But if you will try to decrease your stress with these activities and take medications on time as prescribed by the doctor, you will be all good. Am I clear? Okay. Then great. This is a brochure. This is the leaflet. It contains all the information about irritable bowel syndrome. Please read the instructions. If there is any doubt, you can always ask us. Am I clear? Okay, then take care of yourself and I hope you will be better soon. Okay, yeah, I wish you a speedy recovery. So two things in the end are very important. मतलब जब आपके 350 ऐसे मार्क्स रह जाते हैं तो इसका मतलब आपने क्या अच्छे से नहीं किया. आई रीअश्योर यू, ये नहीं किया. लीफलेट, ये दो चीजें करनी चाहिए. इससे आपका टाइम भी पूरा होता है, आपका फ्लो भी अच्छा बनता है, और अगर आपको नाम दिया हुआ है, नाम भी यूज कर सकते हो. सो आप ऐसे भी कह सकते हो, गुड मॉर्निंग जेनी, दिस इज भूपेश, आई एम अ नर्स ओवर हियर एंड आई कैन सी फ्रॉम, बिकॉज आप देख चुके होंगे. आपको कंफर्म करना है तो ऐसे भी कह सकते हो, गुड मॉर्निंग, माय नेम इज भूपेश, सो कैन आई कंफर्म योर नेम. Well, my name is Jenny. Okay, Jenny, yes, I have got your notes and I can see from the notes that you have been diagnosed with. This is how you start the role play. प्लीज अगेन, इस रिकॉर्डिंग को एक बार सुनने से नहीं होगा, आपको कम से कम 3-4 बार इस रिकॉर्डिंग को सुनना चाहिए. Then it would do something really good for you. Please listen to this recording 5 times, 10 times when before going to bed. जब आप सोने जा रहे हो तो लिसनिंग या स्पीकिंग की रिकॉर्डिंग्स को सुनना चाहिए. अटेम्प्ट नहीं करना चाहिए लिसनिंग को, लेकिन सोते टाइम सुन के सोना चाहिए. आपको बहुत हेल्प करेंगी, बहुत हेल्प. मतलब अटेम्प्ट मत करो, सिर्फ सुनो. और याद करने की कोशिश भी नहीं करनी, अपने आप आपके सबकॉन्शियस माइंड में जाएगी. सोने से पहले वाली चीज सारी रात आपके माइंड में चलती है. यू विल स्टार्ट फीलिंग द डिफरेंस द नेक्स्ट मॉर्निंग. सो प्लीज कीप लिसनिंग टू दिस वीडियो. दिस इज डॉक्टर भूपेश फ्रॉम डॉक्टर BKM इंस्टीट्यूट. सब्सक्राइब अवर चैनल if you have not. Contact us for the best OET coaching. Number is 76967 34256 and Indian ISD code is +91. Thank you.